Hello, this is Kerry Hall, and I'm in studio again today with David and Matthew Hickman from the HIC agency. We're here talking about their various aspects of their wellness program. It's very different, ladies and gentlemen. It's got a whole series of pieces to it. We've talked about that in previous podcasts. But today we're going to talk about a thing called the Healthcare Blue Book. How's that work, Matthew?
Thank you, Kerry. What Healthcare Blue Book is a revolutionary consumer advocacy tool. What it does is it allows our employees to search for the cost and quality of different medical procedures at different facilities. We can also search different hospitals and different providers on there as well. There's a vast array of different procedures we can do, anything from a total knee replacement down to a simple x-ray.
Okay, so David, the idea behind that is to get the employees to start using healthcare that is less expensive. As an example, an MRI that costs $4,600 done at a standalone MRI clinic might cost $800 or $900. But how do you get the employees to do that when they're like, hey, all I got to do is pay a copay. What do I care?
Yeah, and Kerry, that's a great question. One of the things that our agency takes a lot of pride in is educating the employees. And it's no surprise when we start talking to employees about the cost of medical procedures, the cost of prescriptions. There's this mystic out there about, you don't know what the cost is. You go and, a heart procedure is $140,000. And we cut through that and show them, give them a tool that they're able to help control the cost for the employer. They do have skin in the game. They're paying for their dependents to be on the plan. And all of a sudden we're seeing family rates at $1,500, $1,800, $2,000, and they understand that now they're engaged in the process and that they have a tool that can help them pick a better, lower cost and a better quality outcome.
So the idea is then, Matthew, that by doing this, they're helping drive down the cost of healthcare, which means next year when you get your renewal, you may not get an increase. In fact, you may flatline, or if you do get an increase, maybe it's going to be a very small one because everybody's pushing the boat the same way. In other words, we're trying to lower the cost by making good healthcare decisions, yes?
That's exactly right, Kerry. You nailed the nail right on the head with that one. And, something we've seen that exact situation happen. We have groups that 3 years, year over year, are able to offset any increased cost by having money saved back, right? And that's what we're going for here. If we can educate our employees on being the best consumers of healthcare, using the least amount of money to get the best quality for their care, then you're right. We're all working towards the same goal.
That's a win-win situation, ladies and gentlemen. It's called the Healthcare Blue Book, and the HIC agency uses it with all of their clients as part of their package. You can learn more about that at the website HICinsure.com, HICinsure.com.